The next disorder we're going to talk about is schizophreniform disorder. I'm not going to spend too much time on talking about this because it's basically schizophrenia. So read the criteria for schizophrenia again, and this is what it is. It's just the timing of the symptoms is different. So this is if 6 months haven't passed yet to diagnose schizophrenia. So it's less than 6 months, but it's also more than 1 month. So between 1 and 6 months, including the prodromal symptoms too. So this is when you would diagnose schizophreniform. Normally, patients progress from schizophreniform to eventually getting the schizophrenia diagnosis. So just keep the timing in mind. That's the only difference. Brief psychotic disorder. This is the same as schizophrenia, except that the symptoms have only been present for less than a month. They have active psychotic symptoms. A lot of times they progress to schizophreniform and then go on to have schizophrenia eventually. So just keep in mind this timing. Here's the timing again. You have schizophrenia greater than 6 months, schizophreniform 1 to 6 months, and brief psychotic disorder is less than 1 month. Then you have schizoaffective disorder. This is, I like to think of it as schizophrenia with a mood disorder on top of it. You can have schizoaffective depressed type, which is having depressive episodes on top of schizophrenia, or schizoaffective bipolar type, which is when they go hypomanic, manic, depressive episodes and fluctuating. So the main thing is you have prominent mood symptoms in the context of chronic psychosis. They continue to have the auditory visual hallucinations or the delusions even when they're not in the middle of a major depressive episode or a manic episode. This is really important because this is what distinguishes schizoaffective disorder from bipolar disorder type 1. So let's just go over the criteria quickly for schizoaffective disorder. They must meet criteria for either a major depressive episode, manic episode, or mixed episode, and have had the delusions or hallucinations that would meet criteria for schizophrenia for at least 2 weeks in the absence of mood disorder symptoms. So while their mood is totally fine, euthymic, they're still having psychotic symptoms. This is the key that distinguishes it from bipolar. All right? Then the next line, because schizophrenia is often associated with some transient mood disturbances, sometimes schizophrenic patients, they get a little depressed at times here and there. You have to remember that with schizoaffective disorder, the mood disturbances need to be present for a substantial portion of the entire duration of the illness, and they need to be present for the most of it. You can't just have a transient one little episode here, or little mood disorders or little mood symptoms that don't actually meet criteria for mood episodes. Also, like everything else, can't be due to a general medical condition or drugs. And you have to specify schizoaffective, bipolar type, or depressive type. So here's a little graph that can help you distinguish between schizoaffective disorder and bipolar disorder type 1. You can see at the top here, this is schizoaffective disorder. So you have the blue line is your mood. So you can see here they're going up, having a manic episode here. They're hanging out pretty euthymic here, and then they dip down and have another major depressive episode here, and then they kind of go back up. The red line is the presence of psychotic symptoms, hallucinations, delusions, etc. So you can see they're pretty much present the whole time, right? So when they're manic, they have them, and when they're euthymic, they have them, and when they dip, they have them. And the important thing is when they're euthymic, they still have them, and they have to be present for at least 2 weeks in the absence of any mood. So their mood's fine, and they have psychotic symptoms. Then you have bipolar disorder type 1. A clear manic episode here, major depressive episode, manic episode, okay? You only have psychotic symptoms during the manic episode, during the depressive episode, and again during the manic episode here. You don't have them when they're euthymic. There's no psychotic symptoms here. That's the main difference, okay? So bipolar disorder, it's confined, the psychotic symptoms are confined to the mood episodes only. All right, so prognosis and treatment. We're not really going to go into this because we have a separate psychopharmacology lecture, but schizoaffective disorder has a better prognosis than schizophrenia, but it is a little worse than just a plain old mood disorder. Schizophrenia has the worst prognosis, then schizoaffective, then mood disorders with psychosis, and then mood disorders are better than that. Prevalence, age of onset, and genetic risks in schizoaffective disorder are similar to schizophrenia. Treatment involves a combination of antipsychotics, maybe a mood stabilizer, or an antidepressant. The next diagnosis we're going to talk about is delusional disorder. This is a very rare disorder. It's kind of interesting.